My name is Maryanne Makredes Senna. I am a board-certified dermatologist and hair loss specialist practicing at Lahey Hospital and Medical Center in Burlington, Massachusetts. I'm also assistant professor of dermatology at Harvard Medical School. Yeah, I mean, I think that's a really important point, right, from this study, which is when patients come into clinic and they have decided that they want to treat their hair, they want their hair as fast as possible, right? If you have the option between a cream that will make your poison ivy go away in a couple of hours or a cream that's going to take a month, you're obviously going to choose the cream, right? That gets it to go in a couple of hours. The same is true with hair. The same is true with many of the dermatologic conditions that we all treat, right? And so being able to say to patients, look, in this study, as early as 2 months, patients started noticing a difference. I think says a lot in the sense that that might not be every patient, but that this is a treatment that has the potential to work quickly, where you can start seeing a benefit very early on. I think it's also important from a patient compliance standpoint too, right? It's just human nature that if patients are doing something day after day and they don't feel like they've noted an improvement, that the compliance can really trail off. And so I think that's also important, particularly important when we're talking about hair loss therapies, where if patients start to hopefully see a difference that early on, they're more inclined to stick with something in the long run. Yeah, so again, I don't want to draw head-to-head comparisons because that's not what this study did. But what this study does show is that you're able to do the extended release minoxidil, 8.5 milligrams twice a day, and still have very similar side effect profile to what we're seeing with low dose, or even sometimes better side effect profiles than what we're seeing with low dose immediate release oral minoxidil, right? So we're hopefully able to see better efficacy, which I think that's what this data is showing so far. Again, not head-to-head trials, while maintaining a favorable safety profile. And I think that's what's really key. Again, it's going to depend upon the patient who's in front of you. I think for new patients, this is going to, at least in my opinion, going to be one of the first things I turn to, right? Because if it has approval and if we have good safety signal like this study is showing, and we have it's shown to be to date have such good efficacy, it's going to be the obvious choice. As far as patients that we already have, I think if they're already on some therapies, we'll probably add this on as an adjunctive therapy. I just think that this is a really very exciting time because it has been 30 years since we have had an oral approved FDA approved therapy for hair loss, right? To date, we have no FDA approved oral therapies for hair loss in women, and yet 80 million people in the world are affected by hair loss. And so there is a huge unmet need. And I think, the fact that we have these exciting study results, and importantly, that I think what I was most struck by are the patient-reported outcomes, right? Because patients were coming back, and up to 86% of patients were saying, "I'm better," right? As a hair loss clinician, that almost never happens, right? It's like we have to show before and after pictures, and people are like, "Oh yeah," the fact that patients actually said, I feel like this has helped me is huge. And it's really been a long time coming since we've had something meaningful to offer to patients with a study that's been done with this type of rigor. So I think it's really exciting. Yeah, so right now we're running a trial to better understand what causes female pattern hair loss. It is a biopsy study in patients who have not been treated with anything, so who are treatment naive. And so if there are willing patients who would be willing to come in and give us a scalp biopsy, we'd be grateful for that. I think there's so many women affected by female pattern hair loss, and we really don't understand why so many women develop it. And so we're trying to get a better sense of what that is, in the hopes too that if we learn what's driving it in different cases, we can approach it better from a therapeutic standpoint. So that's one thing. And then the other thing is just to say that it's really wonderful to see so many companies and people interested in this space and putting forth different therapeutic options that they're studying for hair loss. And I just want to just say how great that is to see. I've been treating hair loss patients and doing clinical trials myself for 15 years, and just the enthusiasm around this space has really been encouraging in recent years.